Like you can see that the lumen is not narrowed here. It's wide open. This is the lumen, this is wide open, and you can see actually the calcium. So treadmill could be positive somewhere here. Okay, so here it picks up. And you can also see some lesions here which will not be picked up by your CT. That is what I wanted to emphasize on. What's happening? Yeah. So they have documented CT calcium in people who lived long back in Egyptian mummies. Okay, so this is despite the fact that there was no transport there, so they were using their feet. They were on their feet. Okay, they were not smoking. Blood pressure was literally unknown, and majority of the people were eating a plant predominant diet. Then why did this happen in those people? So that's the next question. Yeah, please.
Usually the pharaohs who are rich and who are all eating not plant-based, they were eating meat. So I think that is, um,
Okay, can you repeat? Sorry. So it was meant the
the
mummification
mummy,
was done only
you,
for a select group of people
yes.
who were indulging in non-vegetarian food. This is precisely what I wanted. Thank you. So this was restricted to few people, okay, the kings, their family, and the priests, whom they believed they will connect them to the God in the future. Okay, the priests were connecting the kings and queens to the God in their future. So that was the earlier impression. See what they were eating. So this is what they were eating. So all these were not given to a common man. Okay, this is all what they were eating. And look at this. A huge bone was offered. It was offered, and there is a goose. And I learned that goose has the very high amount of fat, around 63%, and 20% of that is supposed to be saturated fat. Okay, so the mummification was not restricted to the kings and queens. It was also, they also mummified the animals which they were supposed to carry along with them after death so that they can eat it on the way when after passing to reach the God. Okay, so this was the presumption earlier. So the second one, just have a look at this. Okay, just 15 seconds, then we'll move on to the question. So I have made some observations here. Which of the following statement is wrong? China's heart disease burden is more than India given their meat intake. It is less in India given their vegetarian portions, and none of the above. I don't know how many of you answered, but it looks like predominantly none of the above. What did you observe from the previous slide? I'll put it up again. Now look at that. Is it in red? Red, India versus China. So who had more disease? Of course, this is a very old statistics. Okay, it is slightly different now, but this is I think from 2013. Can you see that actually we had more disease than them at that time? So what was the real cause? Anything specific? Can you imagine if I am to travel to China, I think I'll have to do a lot of homework now because I wonder whether I will have a whole food plant-based diet, isn't it? That is the level. Why is that they had lesser disease than us? The answer lies here. despite having a large amount of non-vegetarian food, the vegetable intake in them was very high. That drives the point. That is where we come to a plant predominant diet. Okay? Pardon? Oh, yeah, that's right. So I'm not going into the final, I'm just coming to drive a point that vegetables play a huge role, okay? And look at the next slide. China consumes right now in 2020 half of the worldwide vegetable consumption, okay? So there, apart from this, all that European food, American food, all the Western food have come into their Chinese food also, okay? So now the disease pattern has completely changed. This is the 2013 data. And I always make a point here that just because the Chinese are eating so much of vegetables, we are not eating that. Okay. This slide I'll skip. Okay, this is what the present Indian guidelines mentioned. This is actually the Lancet study was the global burden disease of Lancet study done in 2016, which said dietary risks are more important. Okay, when you go to a cardiologist with a heart disease, they ask whether you are a hypertensive, whether you are a diabetic, all those things. Look at this. Actually, the hypertension is the second cause. Diabetes comes very low. More than the smoking, air pollution comes. Okay, and 56% DALI is by the dietary risk. And this slide again was shown by Dr. Ajina, so I'll open this out. So when you go to a doctor, the risk factors are mentioned like this. Your non-veg, your meat, your sugar sweetened beverages are the causes. Whereas the major causes are actually not taking plant-based diet. Okay, so the plant-based diet is going to be the game changer. I'll skip this also. Maybe I'll skip this too. Yeah. I think she didn't quote Interheart study, so I can make use of this. Interheart study was done in 52 countries. It's basically a large standardized case control study, and it was on acute MI patients. 2/3 of the MI were actually caused by smoking and dyslipidemia. 1/3 of them could have been prevented by just increasing the vegetables and fruit intake, and 80% of them could have been reduced if we had included physical activity and smoking abstinence. Okay, now here I would like to drive a point again. So the common risk factors for cardiovascular diseases will be your diet, hypertension, dyslipidemia, and obesity. This is what we all presume. But if you take patients admitted with MI in your own hospital, only 50% of them will have one of them or many of them. In 50%, they may not have any obvious cause. That is because we leave behind the lifestyle risk factors. Okay, when you include them, then you get 90% of the causes. But still there could be something which could have been missed out. Okay, so guidelines, when it comes to guidelines, we all bank on guidelines, isn't it? Every time a guideline comes out, no, it comes through the pharma, mainly it reaches out the doctors and people share it in WhatsApp and whatever social platforms. I'm not sure how many of them actually read it, okay? So now what is important is in every guideline, diet and exercise are given enough of importance. Those pages get skipped out by us too. So we start everything from the 100th page to 150 because that is where the drugs are mentioned, okay, in the first few pages. So I was talking to one of my colleagues, endocrinology colleagues, and I was asking what is the latest in ADA guidelines regarding diet. Okay, and I gave him a point that whole food plant-based diet has already found a place in ADA guidelines. He was like this, I'm not sure, JR. Okay, so that's because we don't bother to read it now, but we claim that there is no evidence for this. So generally when it comes to guidelines, our guidelines have unfortunately been not framed by the studies done here. That is the most disappointing thing. Okay, that is where we all should join hands, come out with data. So American Heart Association and European Society of Cardiology, these are the main guidelines which we follow. And what do they say? Of course, that's going to be a very difficult thing to conduct a study based on diet, because everything is based on recall, 24 hours recall. Okay, nobody maintains a diary. Even maintaining a diary 3 times a day is going to be very, very difficult. And doing a double-blind study is even more difficult. I mean, it's just not practical. I won't use the word difficult. It is not practical. So, what do these guidelines say? Do they really talk about whole food plant-based diet? I've already given the answer, so let me not wait for the answer here. Yeah, so guidelines definitely prescribe whole food plant-based diets. How much do they prescribe? That is what we are going to say in the next few slides. So I told you 2 guidelines. One is the American guideline, other one is the European guidelines. What do they prescribe? Look at this. What is the selling point? The one above is going to be the American Heart Association guideline. The one below is the European Society of Cardiology, ESC guidelines. So ESC guideline clearly states adopting a more plant and less animal-based food pattern is their selling point. They have not used the word whole food plant-based diet at this level. Let's see for more evidence. Okay, whereas the American AHA guidelines give emphasis on energy intake and expenditure to achieve a healthy body weight. Okay, when it comes to fruits and vegetables, American Heart guidelines say eat in plenty and in variety. Okay, whereas the European guidelines say that you should take more than 200 grams of fruits and vegetables each. Okay, that comes to a minimum of 4 servings. Minimum of 4 servings. When it comes to whole grains, both of them say that you should avoid whole grains when it comes to grains. And the grain should be the predominant source of fiber as far as the ESC is concerned. Now see, the word whole food plant-based diet has not been explicitly used here, but it is the meaning. Okay. Fat, again, don't use animal fat. That is the inference from both of them. And keep the SFA to less than 10%. I think AHA says less than 7%. Okay, when it comes to proteins, again, look at the word. AHA very clearly says mostly protein from plants. It specifies that it could be legumes and nuts. Otherwise, it could be from seafood or fish. Low fat or fat-free dairy products. Choose lean cuts and avoid processed forms. Okay, so a similar statement from ESC also. So it's more predominant, more emphasis on nuts and fish. Pardon? No, this is only, yeah. Okay. Regarding processed fruits, minimally processed fruits. So avoid ultra-processed. Okay. Salt, yeah, both agree upon each other. Alcohol, no to alcohol, especially if you are already not taking alcohol, just for its clinical benefit. Now we still say that alcohol is useful, okay? That has been taken away, basically. Sugar, again, same, ditto statement. And finally, the AHA's advice is adhere to this guidance regardless of where food is prepared or consumed. And here they say MD is for Mediterranean diet. That is what. So both the guidelines basically say whole food plant-based diet without using those terms. Okay. Now, this study was published in 2021. This guidance came from 2021. They basically categorized people into 2 groups, high risk and low risk. Okay, high or very high risk, low and moderate risk. These 2 are clubbed together. Okay, there are 2 different recommendations they have given. Okay, now let's see what they say. I have put up this very high group in green and moderate and low risk in red. It looks a little paradoxical. You will understand why I have put it up later. So when it comes, they have just given various groups of food. When it comes to plant food, if you are under a high risk category, then you are supposed to take fresh fruit, raw or cooked vegetables and pulses. If you don't have that much of risk, maybe you can include little bit of candies, etc. Okay. Unrefined carbohydrate is best for people at high risk, but you can also take some white rice if you are not at that high risk. Whole grains, again, you can even take white bread once in a while if you are going to belong to the moderate risk. Dairy, again, low fat, maybe once in a while if you can indulge in ice cream. Fat, predominantly plant-based. Okay. Salt, that alone they say it is same as for high risk. Otherwise, rest of the things, that little bit of moderation is allowed for people with low to moderate risk. Okay. Similarly, they have just given some specifications. Now, why is this color difference? Why is this paradox? Was it intentionally done or was it done without a purpose? Low risk can become a high risk.
That's why the
So if you are going to take all that in green, you will ever remain in green. Okay? If you are going to take the ones in red, you are going to become that. Okay? Now I'll just tell a small story. How many of you can read Tamil? Is there anyone who can read Tamil? You can read. Can you read it out? Just introduce yourself. You are? Great. Do you know this movie?
No, it's an old movie, right? So
It's a very old movie, but you can identify the actor. I think
it's
many of you can
Sendil.
identify.
It's Sendil, right?
No, the other person.
Countermany.
See, you can't miss out Kamala Hassan and say Sendil. People here will not be knowing Sendil at all. Sendil is a comedian. The other guy, this guy,
Countermany.
this guy is,
I have no idea.
this guy is Kamala Hassan, man.
Hassan. Yeah.
Oh, okay.
Kamala Hassan.
What is this?
I'll read it.
Is it Delhi? But you know Sendil, which many of you may not, none of you must be knowing, isn't it? So can you read out this
Yeah.
and translate into Hindi or in English?
Okay.
You've forgotten Tamil? I hope I'm not dragging you.
I'll read it.
Yeah.
So what he's saying here is the one on the right is the chicken, which was unskinned when it was big in size, and the one on the left hand was the one he unskinned when it was in small in size. No?
Okay.
Okay, yeah, I'll read it.
Okay.
இந்த கோழி பெருசா இருக்கும் போது உரிச்சது, அதே கோழியை சிறுசா இருக்கும் போது உரிச்சது இது. That means, like when he's having two chicken in hand, he says, when this chicken, when it was big, I skinned it. The other one, when it was small, I skinned it. So that's why it looks different.
Okay. Thank you both. Okay, basically Sendil is a comedian and he has been instructed to buy chicken 2 kgs. One rider is that we should get only one piece, one chicken. It should come from one chicken alone. So he goes to Kamala Hassan. Kamala Hassan doesn't find a piece which weighs 2 kgs. So he gives him 2 pieces. Okay, one big and one small. So Sendil gets confused. No, I want only one. Okay, then Kamala Hassan says, no, this is the same chicken only. This I peeled off when it was very small, and now when it has become big, so what is small only is likely to become big. So where is the question of differentiating between low risk, a different diet for a low risk and moderate risk group, unless you want acceptability as the main component. Sustainability, patient, no, it's easy to prescribe. Somebody has to follow it. Okay, so that's where the difference in prescription came up. Okay, now I'll skip this too. Um, Maybe this is something which is of importance. You can see this. So the one in green, obviously they are supposed to be taken more. So at least 2 servings of vegetables, 2 servings of fruits and complex carbohydrates. Okay, that is to be taken every day. Nuts and seeds, maybe a little bit of oil. So that is all limited to 1 serving. That's a yogurt. And look at this, not more than 4 servings. Okay, now let's go back to this. 4 servings per week. So even if you're going to take fish, this is 7 by 7. So this is 7 by 7, this is 4 by 7. Okay, so this is, so you must know when you say little bit of unacceptable things, then you must know how much you must prescribe. Okay, so this is all in greens. Then we'll obviously go on to things in yellow. So not more than 3 times a week, not more than 2 times a week, and occasionally. Okay, now you can go back to this. I'm sorry. Now you can go back to this slide. Maybe you can start prescribing. So this is the best way to make people follow, though whole food plant-based diet 100% is the best way out. But if you aim for the moon, you will never achieve it. Okay, it's important that you take step by step. So this is where things hold good. So as Dr. Ajina was pointing out, it is important you focus on things which have to be increased. So that makes people to follow. And that is the one which is going to show remarkable change also in the outcome. Okay. So there are lots and lots of guidelines have come up since 2010 to 2021. And look at that, majority of the guidelines are focusing on this only. And again, I'll skip that. But I would focus on few guidelines which have come out in the last 10 years or so. So this was published in 2022. And look at that, UK, Australia, Belgium, Lebanon, Malaysia, and Malta, they all say that whole food plant-based diet is a complete food. Okay, a lot of changes have come. The only problem is I'm not sure whether the UK doctors themselves know about this. Sorry to make such a sweeping comment, because one of my students is a cardiologist. So he knows me as an aggressive interventional fellow, and he was smiling when I said I have switched out completely to preventive. And I asked him, what do you prescribe? Okay, I asked him, what do you prescribe for dyslipidemia, uncontrolled dyslipidemia? I said, no, that was not the answer. He said, I will refer him to a lipidologist. Okay, next, I didn't ask what diet we will prescribe. I'm sure now what will be his answer. Okay. So, what does Qatar say? And imagine that is in 2015. So when we say Qatar guidelines, you will always think that, okay, they also say it is a complete food, and they say avoid junk food. This is just the crux which I have taken from this particular publication. Norway says whole food plant-based diet is useful across ages. Nordic Council says it prevents chronic diseases, and Chinese guidelines in 2018 say if you follow a whole food plant-based diet, it is going to boost your immunity. So every guideline has given emphasis on whole food plant-based diet for some purpose or other. Okay, don't say whole food plant-based diet. They say it's a plant predominant diet. That is precisely what we are also emphasizing here. Finland Finland says if you are going to adopt a plant-based diet, it makes you move faster and makes you give up smoking also. Okay? I'm sure if you are going to eat vada, biryani, etc., you will be tempted to smoke. But if you are going to eat fruits and vegetables, the intention to smoke is less. Okay, I think this Dr. Regina pointed out, Canadian guidelines had included milk as a separate group long back, and they have taken milk totally and they have included it as part of proteins. Okay, and they are saying that you go for plant-based milk substitutes. Belgium mentions that you can have calcium without dairy, and they say drinking water is a very good source. Okay, they also encourage fortified plant-based milks. Netherlands and Nordic Council, roughly a decade ago, they included this because of sustainability reasons. So, you would have heard this word One Health, and that's the reason all these guidelines have started focusing on the health of the planet also when they come out with the guideline. So, plant-based diet is basically a whole food plant-based diet is what is important. As was mentioned earlier, a vegan diet need not necessarily be healthy. So we don't need to bring in that word, though it is interchangeably used. That is not to be used. Okay. So half of what you eat as in a day should come from your fruits and vegetables, which will come to around 4 to 6 servings. And 1/4 is from proteins and 1/4 is from your complex carbohydrates. So this forms the basis of whole food plant-based diet. This I'll wait for 30 seconds. Five letters using these, 2 words using these 5 letters. Earth, heart and earth. Okay, great. So the heart and earth. So if you want to say the plants, if you want to say the planet, it's important that if a politician is invited for a meeting, they'll say, I'm going to plant so many trees. They will remove the trees and then they will plant it somewhere else. But what is more important is eating plants is going to save us as well as the planets. That is the most important message. Okay, I think Dr. Gina showed this picture, planetary health plate. And so if you're going to eat more of plants, it's going to help you bring down all these risk factors as well as diseases, and it's going to help us protect our environment. Okay, that is the most important thing. And I think I have a question left. What is this? Takshruti? No? Yeah, Regina. You saw this picture. So after the surgery for a malignancy, this man kept on smoking and he didn't change. So if you're not going to change, you're going to have a disease again. And the first change should come from us. Okay, that's the most important thing. I don't expect everybody in this room, 100% of them, to follow 100% of what is expected or written in the books. But it's important that you start moving towards it. That's the most important thing. Maybe I think, is there a cardiologist in this group? If not, I will skip this. I'll skip this. And this is something which we came out. Okay, I think our next speaker is going to speak on the gut. So what you eat, irrespective of your age, is going to be the reason for your problem. Okay. So this is, I made this, okay, both PAN group and my own colleagues helped me out in this one. I had been to Kenya recently, so I thought I'll use that pictures here. So the things start from birth. Okay, I witnessed this delivery. We stayed on there to see the delivery, and the calf started walking until it started, that is not the cough, that is a different one. Okay, so we had these pictures. So the things have to start from birth, okay, at the schooling age, at the feeding age, and what you eat really matters. What you eat only matters majority of the times. Thank you. We can take up questions now or during the discussion too. I think we are having a question also. We are having a question.
May I ask a question for you? I have a question. Have you seen atherosclerosis in the coronaries recede after starting plant-based diet as a study?
Sir, there is a mic.
I've chosen to take away those slides basically, but I will say there are two people who have been doing extensive work on that. One is Dr. Dean Ornish, other one is Dr. Esselstyn. They're actually on the other extremes. Like one of them doesn't even give medication. Dr. Dean Ornish doesn't give medications, whereas Dr. Esselstyn prescribes medications too. Okay, so both of them have shown regression of atherosclerosis. And there has been a study called Mount Abu study in India. I think it's in Rajasthan. Rajasthan, they have also shown. I have done a study, but I have not shown regression. Okay, I've basically taken 28 patients. These are all patients who had undergone multiple procedures, like either bypass surgery or stenting, but they had recurrent events. And the surgeon or the treating cardiologist said, we can't do anything more than this. Okay, so what we chose to do was to get them admitted. This happened 5 years ago, 2019. We admitted them. We tested few things like endothelial function assessment. Again, I have not touched upon that. There are slides after that, but I didn't want to touch upon that. So we assessed only the endothelial function and their symptoms. Okay, so we had an adherence scale also. We decided to have a scale like how many people were 100% following it and how many people were following less than 50 and above. This is the way we classified. People who had 100% adherence to all the 6 pillars had become entirely asymptomatic. They had become even class 1 to class 4, believe it or not. Their drugs, especially the diabetic drugs and the anti-anginals, had come down significantly. And inside the hospital, all of them had an improvement in endothelial function. The problem was in the follow-up only. There were 2 problems. One, intrinsic, as you could see that, like whether they were able to stick on to that diet. And the second thing was the COVID, which came up. Okay, unfortunately, it was timed in such a, it was timed because at that time we never had an idea of COVID. So we lost follow-up of those people. Of those 28 patients, I have 4 or 5 of them coming to me still, and they are doing well without symptoms. All of them on maximal medications had class 4 symptoms. No, we didn't do an angiogram in any of these patients. We had only symptomatic improvement and endothelial function testing. That endothelial function testing was done at the end of the 10th day itself. No, we didn't do carrot CAMT, we didn't do any PET or any of those imaging. See, when the intention was to make them less symptomatic. That's it. Because
So the less symptoms happen within 10 days or 1 month?
within 10 days. Within 10 days. Because it was an intensive lifestyle modification inside the hospital.
Excuse me, sir.
Yeah.
Yeah.
We kept them for 10 days.
So we are convinced about your vegetable diet being useful. How long did you take to shift from becoming an aggressive interventionist to advising vegetable food, how long did you take and what did
For me to change or?
Yes, for you, because unless you tell us what were your challenges, how will we change?
Yes, sir, your story, sir, please.
I think we are going to talk on the panel.
Just states,
I'll do that.
how long did it
There is
take you?
nothing very interesting in that. Anyhow, I'll share. Yeah, sorry.
In your slides, you would shown fish to be in green. Given the so much awareness and talks going about the toxicity and how the fishes are, would you still show it in green?
Yeah, that is the guidelines, what guidelines say. That is the main reason why I said it is ideal to follow 100% whole food plant-based diet, but people will not be accepting that. So that is where you should come out, say, okay, fine, if you are eating this, you must stick out to this level. That is what I said. I didn't say that you eat. If you're going to eat, restrict it. Yeah, please.
Yeah, basically what we are trying to say is guidelines comes every 5 years because they do the analysis. And so the data which is coming in the guideline is 5 years old. So what me and Dr. G are trying to communicate is actually don't be restrictive. Make the other thing positive, like ask them to eat more of healthier stuff. So naturally this will come down. It's a process. You know, like first you learn that eating those things will help you, then you will start liking those tastes and then you will be able to get out of it. Otherwise, when you address mass and you ask them to completely cut down these things, then it is an ideology and a lot of other things comes into the picture. So to be welcoming actually.
So it's very difficult to say what's really happening in that 5 years. Okay. Now, earlier, definitely, I'm very sure at one point of time they're going to take fish out of this because.
Yeah, because it's not seen here. So first and foremost, I wanted to thank all of you for coming here, especially on a festival day, Sunday. And though we expected around 80 people, I think it's all close to 40 right now, right? Yeah, I think with the numbers. Hope that another 20, 30 more, start coming. Already one is already in. So the idea is not to have a CME as such, continuous medical education program, which we are planning in due course of time. This is basically an awareness program. Bring all of us together, people who are already doing nutrition intervention, who are practicing nutrition intervention, who are advocating nutrition intervention together under one platform so that we can do a lot of things together. That's the idea. Hence, don't think that it's going to be a CME with a lot of information passed out to you, but there is information. More than that, it's all of us coming together. So our model of work is normally, so we work, I think Shruti will be giving in detail these things. Basically, we work in different areas. One is basically training, integrating nutrition intervention into the core of the curriculum or core of the healthcare system. Part of that, we have two ways of doing it. One is bringing practicing doctors together, provide them tools and resources. One of the tools is having these CMEs, so knowledge is given. And other tools, we are also thinking of working on some apps and other things to help you with managing these things. And that is one part of it. And the second part of it is basically integrating nutrition intervention into the core of the curriculum. That I will tell you why it is needed. That's needed. How many of you, think that nutrition has to be at the core of the curriculum? Yeah. I do have all my stalwarts here. Yeah, definitely. So that is one part of this thing where we are working with the medical colleges. We have done CMEs in 6 AIMS and other 8 government medical colleges. And as I mentioned, tools and resources development is another one. And the next one is, so we have like policy advisory, industry guidance, partnerships and collaborations. Dr. Sanchita and my executive director, Rinki Singh, are working on the policy advisory part. They keep meeting with FSSA every time to come up with some newer guidelines actually. They're finding it difficult, but they are consistently working on it. And industry guidance, we do have few industry people who've joined us who can actually help us in coming up with better products actually. So we will be in the advisory panel of those things. And then partnerships and collaborations, multiple partnerships and collaborations are in the process. And all of these, we need a very strong, scientifically oriented medical team who can lead this. That's why we are all together. So when we come together, we will have different roles to play. Some as ambassadors who will be spreading, they will be the face of PAN, they will be spreading the message among their fraternity and the population at large. And at the same time, as I mentioned, there will be like industry advisory, policy advisory. There will be a set of teams working with us. And then we have the last part, which we started in this year, by mid of the year. We started with some effort on research collaborations. We kind of collaborated with ICMR and NIN to do a study on whole food plant-based diet and the benefit of diabetic management. How many of you, anybody in this room, came across any nutrition studies, or who involved with any nutrition studies so far? Nobody. We're all doctors. Okay, very good. Can you just explain what did you do?
Right now, we are seeing how the nutrition intervention that we are giving to GDM patients, it has a difference in the birth outcomes.
Excellent.
Yes.
So how many people, or it's a random one, or it's a designed trial, or it's
Ma'am,
just?
it's a RCT.
Okay. RCT, wow. How many people, how many is a?
Ma'am, right now it's a pilot study, so we have 120 patients.
Yeah, Shruti, please make a note of this, we'll have to. Anybody else came across or involved with any nutrition studies?
I'm also working as a dietitian, so we are seeing the effect of vitamin D supplementation in NAFLD individuals, so the fatty liver patients, in obese individuals. So it is also an RCT.
Excellent. Oh, so the young medical student, did you come across any plant-based studies in your colleges?
I did try to, start some research on plant-based diet or something on patients. And so far we have not been able to do that trial. I was targeting PCOS patients and seeing if any dietary intervention can reduce it. But my project did not get through because they did not really believe that a plant-based diet can help
Excellent.
PCOS patients.
This is the truth, right? This is what we explain. I think you should connect with Dr. GR. His team is doing great things there. You are there in the group, right?
Yeah,
we will connect actually. He's doing great things. He has a preventive cardiology unit with a whole full set team. They're doing even a lot of public programs. We should connect. So that's the idea. Bring all of us together, whoever is involved with the research, whoever is involved with the public advisory, bring each of us together so that it becomes a movement, it becomes a revolution, which will help not only us, our future generations, indirectly the planet too. So, again, any younger medical students here, why nutrition has to be at the core metrics of the curriculum or the healthcare system? Anybody? Now we have nutritionists, your role is very important. My organization itself have nutritionists. That nutritionist is the main person who's working with the patient. Why still physician need to learn nutrition? Okay, answer I'm going to talk. Sorry, my thoughts and other things are affected since yesterday. So basically, when you look at the healthcare landscape, whatever we have learned as physicians is basically designed 20 years ago, right? As 40-something, 20 years ago, whatever they have designed, we learned actually. So it was actually the healthcare landscape, if you look at the health disease landscape, if you look at 1990s, major part of our diseases were like 60 to 70% of it is non-NCDs actually, it is infectious diseases. And by 2016, when you look at the number, 74% and more globally, the disease burden is due to non-communicable diseases. It's just the lifestyle which kind of creating these issues. In India, it is like 66% as per 2020. This number is like 2016. So that is one aspect of the story. So the kind of management which we were doing before needs to be changed or needs to be aligned with what we are facing right now. But we haven't done enough effort on those things. We always went ahead with the same way, okay, there is a disease, infection, antibiotic. There is a hypertension, giving a medicine to reduce it. We never thought about addressing the root cause of the illness. That's something which we need to work. At the same time, there are a lot of other issues which is coming in. We just came out of a pandemic, which is COVID-19, and then climate change and natural disasters. We may be thinking that, oh, it is not something which is very obvious in India, but we are facing, all of us are facing. In Bangalore, actually October timeframe, there is no rain. We had flooding in Bangalore. Not only the flood, when you go through the areas of slum and maybe not so well-developed areas, it's like full of that clay type of sand, and it's so difficult, it can spread multiple infections. We all know that malaria to multiple other diseases are due to that. But we don't have the statistics on those numbers, but it is coming up now. When you look at all these issues, there is a common thread. What is it? That's our food system. The way we eat, the way we live is actually causing these issues. 90% of the issues in disease management can be or should be addressed with the nutrition. That's what the latest statistics says. And yeah, I think any other new medical student, only one person, any other new medical student? Okay. So when disease management comes, especially NCDs comes, what we learn that it has to be managed with lifestyle intervention. Even our Harrison says, okay, first line of management, weight reduction, healthy eating, exercise. How many of you actually advise your patients to take up a healthy eating habit? Okay, what do you guys advise? I know, the lifestyle medicine group aside, what do you advise? Okay, most of the doctors, whatever we have done, the surveys we have done, it says that they ask them to reduce the quantity of food, the oil, or reduce weight, go for a walk. That's the minimal advice they give. Patient is clueless. This oil is not used, what else I should be using? Because it's a very partial, superficial advice we are giving. 2 reasons, the survey says that 2 reasons. 1, lack of time. That's not always the case. Second is inadequate knowledge. They don't know, we ourselves don't know what is to be advised to our patients, right? Only the superficial level of knowledge we have. Community medicine, 3rd year, 4th year we have, how many hours of nutrition? 15 hours or less than that. So we don't know how to advise our patients. So any diseases, we are all very clear. The management should be starting from the distal causes, which our Dr. Sanjita and Dr. Springy Singh are already working on it. Medial causes, a lot of them we can address. If you have a psychologist, we can help them with a lot of these factors. Proximal causes, something which we all can address. Ask them to increase more fruits, vegetables, less of animal product, less of oil. All these things we can definitely advise if you have a team. What we are working as physicians, and also just imagine the medical entrance, the NEET and other things, the kind of filtration it goes through. Even my daughter wants to do medicine now. So I know the kind of, strenuous, intense training they have to go through. And also you select the top, how many percent? 1% or something. And they're coming there only managing that part, risk factors. Such a stupid thing to do, right? But we are trained, we are primed to do that actually. So any risk factor, we manage it by giving medications. That's what we are doing. But we are able to do much beyond that, because we are kind of like all those 5, 6 years or 7, 8 years of training put us into a kind of a very narrow frame where a medicine, a drug, a medicine, a drug. That's what actually, this is a drug. That's what we are able to do. We are not able to go beyond that. This is what exactly we are doing. Actually, there is a leak tap and it is flooding the room, but we are actually busy with mopping it. We are not giving the right things to our patients. This situation needs to change. Even if your family member, your husband, your wife, your children, or whoever is getting sick, when they go to a doctor, the first thing they should do is nutrition and lifestyle intervention. If it doesn't work for multiple reasons, you can always have other arenas. Or this should be the way of management. But if you look at the overall healthcare landscape across or globally, you can see that US is already much advanced compared to us, because they already have a kind of riding the wave. Nutrition and lifestyle intervention, we are all certified with IBLM. So where we got certified, it's with IBLM, ACL, American College of Lifestyle Medicine. They are actually riding the wave. And then lifestyle medicine is the only way to manage diseases? It's not. So certain cases, lifestyle intervention will not work, maybe because of lack of adherence, or maybe because there is a strong familial component or some other reason. So you always have a role for optimal medical therapy, and surgeries and procedures also has its role. That's why a doctor needs to come into the picture, because he will understand much better than others where nutrition intervention work or lifestyle intervention work, where it doesn't work, right? Sorry. Physicians, this is what I said. Currently, how many of you following Rujeda? Rujeda Deepak? Yes. Okay. How many of you following Pooja Makhija? Okay. So basically, what even people like us who are scientifically oriented, who knows about things, are following some of the social media influencers to get knowledge and adapt to our lifestyle. We are not actually having the skill set. So basically, common man is totally confused. One side, your cardiologist says, oh yeah, you should go for a low carbohydrate, high fat diet or keto diet, and the other side, somebody is saying that you should eat more fruits and vegetables. They're totally confused where to believe, whom to believe, or protein supplements to be taken. They're totally confused. This confusion needs to be avoided. And finally, he goes to the physician. And including my cousin, I was telling Dr. GR, he's a cardiologist who I used to take a lot of advice. He's still talking about LCHF. You need to eat more proteins. Yeah, that's the way it is going. So the physician himself doesn't have enough knowledge to guide their patient to manage these diseases. So we are in a soup. This is some proof for that. This is not an Indian scenario. This is happening globally. This is actually Crowley et al. Actually, they are also saying that nutrition is insufficiently incorporated in the medical curriculum. Because of that, when you come out as a doctor, you are not able to actually guide people the way it is to be guided, to lose weight, to reduce their cholesterol. Have you done any, other than the ideological part of being a vegan, have you started recommending your patients to eat more fruits, vegetables, legumes and all? Excellent. Yes, ma'am.
On a fruit diet.
Excellent. But how many people are able to do it and consistently do it?
No, they do follow.
Excellent. Very good. So there are some like pearls here and there, right? Great. This is Harvard. This is a survey I was talking about. Like we have done a survey before getting into India, 2022, and we did it with the Kriya Decrypt. It says that physicians, again the same global phenomenon, we don't have adequate knowledge and we don't practice, we don't have time. Finally, it goes to a nutritionist, the patient doesn't follow completely whatever it's told by the nutritionist. And it says that doctors, being at the apex of the healthcare system, we do have a much higher say in the whole thing, changing the whole thing. Because patient will listen to us, we can also influence these policymakers and others at a higher level. But as doctors, we are not using that social status to make changes. We are using it for all unwanted things. This is something which we need to change. It can change not only the people and health, it can also change the planet. So we should all actually take a pledge that we will all become part of this and make the necessary change required for us to live a healthier, longer life. And how many of you feel that nutrition is very confusing? Because one side keto, one side, yes, family physician, I can definitely understand. Dr. Sanchita, anybody else? It's confusing. So,
I think we'll get there.
excellent, that's the right answer. Basically, it's not confusing. As we said, we never gave a lot of importance to nutrition as a specialty or as a domain. We always taken it as a second-hand thing. And hence, the studies were much less, maybe 20 years ago. But if you look at over the last 20 years, there are like lakhs of studies which came in, and there are tools to analyze things better. But we are lagging behind because we don't have the fundamental basic knowledge to analyze it and come to logical conclusions about it. This gap, if you don't build, we will not be able to get to the next level. At the same time, all the nutrition studies are done by people who are not directly related to nutrition. Even the dietitians, the nutritionists are getting very less funds for their studies. Yeah, this is a confusion for everybody, but let's see how we can actually, in the superficial level, how we can make sense of it, and we will come up with more and more courses on this. A little bit understanding the history of nutrition, as ma'am said, sometimes it's better to know this history so that you know that it's an evolutionary process, whether to believe it or you can start